80-year-old woman infected with COVID-19 in Gadag. Victim rushed to GIMS hospital in the district. Woman's 16 other family members also admitted to the hospital. The woman had no travel history. The health department is now trying to find out the source of contamination. This is absolutely very scary given the fact that this particular woman has no travel history. It does appear that it is the case of community transmission, which is stage 3rd. Remember that there are several other cases already of community transmission that have been reported from various other states across the country. And what such case also comes to light from Gadag, India as of now still hasn't entered the 3rd stage, which is community transmission. As per the experts, India still is in stage 2. Now here, 80-year-old woman with no travel history has been infected with COVID-19. Woman's 16 other family members also have been admitted to the hospital. The health experts right now trying to figure out how many people had come in contact with the victim and also where exactly did she contract the deadly virus. My colleague Ashish Parikh joins us live with more inputs on it. Well, Ashish, community transmission threat looms large. We already have had several cases where patients with no travel history have tested positive. While the health experts continue to say that India is still in stage 2, with this case or with several other cases coming to light, has India stepped into stage 3?
Well, absolutely, Neha. Now, this obviously seems like another case that could possibly point towards community transmission. But having said that, speaking about clusters of cases like this, we also had, we were speaking to a couple of experts the other day, and all they had to say is that many countries across Europe also, not the entire country has entered into community transmission. You have clusters of, clusters and hotspots which have entered into community transmission. For example, on one hand, you have a particular state in a country that has, many cases when you take the population. On the other hand, you have a country which does not really have those many number of cases, to consider it to be into stage 3. So this, the entire concept of stage 3 does not really apply to an entire country as such. It could, possibly be distributed or possibly be applied to particular clusters or particular places in a country. So speaking about overall stage 3, we are very far from that. That is for sure. But having said that, there are certain clusters across the country, certain hotspots that now are showing cases, that now are coming up with cases which do not really have any sort of travel history or contact history. So that obviously does point towards community transmission. But does that mean that the entire country is stepping into community transmission? That seems to be a bit too far-fetched to say. But as of now, yes, there are a few cases that are popping up across the country which do not really have any sort of background. You don't have any travel history, you do not have any contact history. So that has become a major headache for the authorities. For example, let's take the case case of our own state, Nanjangud. You had one patient number 52, who actually had come up with symptoms of COVID-19. But how exactly did that happen? You have multiple people now affected in that same locality, in fact the same company that he was working on, but nobody has any idea where it came from. He has no travel history, neither do the other 20 plus people who have come who have shown symptoms of COVID-19. So that is, the clusters might have community transmission but not the entire country. So these are the concepts that need to be understood, because obviously saying that we possibly are stepping into community transmission could actually create a lot of panic. But obviously there are clusters, it cannot be denied. The clusters are showing coming up with symptoms, coming up with patients with no travel history, no contact history. But there are many other places, much more places in the country that actually are showing cases, are coming up with cases with clear contact history and travel history. So clearly the authorities now have everything in control as far as we can see. But having said that, the entire country actually showing this kind of cases, these kind of cases could actually mean that there is some sort of community transmission that we possibly have stepped into. But as of now, it's just a cluster that we're talking about now.